So I'm very proud to introduce a colleague. Lola Adedokun is the Executive Director of Aspen Global Innovators Group at the Aspen Institute. She's also the co-chair of the Aspen Institute Forum on Women and Girls. So as you heard, she's got over 15 years of experience working in healthcare philanthropy. She spent quite some time with the Doris Duke Charitable Foundation and also the New York City Department of Health and Mental Hygiene before joining the Aspen Institute in December 2021. Now there, she leads a dynamic team advancing a portfolio of programs that expand opportunities to and access to health and prosperity for people at the world's margins, both in the US and abroad. So I'd like to welcome Lola to take forward the conversation with our panelists. Welcome.
Thank you so much for this insightful conversation, and it could not be more timely. I think we will all agree. At the Aspen Global Innovators Group, we take an ecosystem approach to addressing some of the world's most challenging global health and development challenges. And I'm pleased that this panel that we are introducing today actually reflects that ecosystem strategy. The key stakeholders who are part of both building, rebuilding, and strengthening health systems to ensure that there is an embedded sense of trust on all parts of the society. So at this moment, I would like to take a moment to briefly introduce our incredibly powerful panel. There's never enough time, so we'll do our best to get to some of the biggest, most important nuggets and reactions from this panel to this incredible report, and then go into a bit of a conversation. Please first to introduce Dr. Richard Aya, Senior Lecturer of Public Health at the University of Nairobi. He brings both he's a medical doctor, an expert in health policy and health systems management. He's also the director and chair of the Center for Health Solutions in Kenya, and has played an incredibly important role both at the intersection of academia, government, and politics. So pleased to welcome Dr. Richard to this conversation. I'm also thrilled to introduce Dr. Robert Newman, who is the director of AMP Health. AMP Health is one of the 4 flagship programs of the Aspen Global Innovators Group. Robert brings 25 years of experience in global health and development and has worked extensively in Africa, the Americas, Asia, and Europe. He's currently the director of AMP Health and is working with African governments to build visionary and effective teams across the continent. And finally, I'm really thrilled to introduce Lola Mngong, who's Chief of Staff of AMREF, which is one of the leading civil society organizations that is critically powerful and empowering community voice, but also engaging at the intersection of both government, civil society, in building strong health systems. And further, she brings more than 15 years of leadership in global health and diplomacy and the coordination of strategic partnerships. She also brings expertise, similarly to Dr. Robert Newman, from working at Gavi, the Vaccine Alliance, the CDC, PEPFAR, and other incredibly important organizations that guide health strategy around the globe. So pleased to have this incredible panel to have this conversation with us today. Before we launch into the conversation, I thought we would give about 2 to 3 minutes for each of our panelists to just take a moment to react to the results of this important report based on their expertise and how that might influence their work going forward. And I'll start with you, Dr. Aya. What are your reactions to this important report?
Yeah, thanks, Lola. I mean, I like the report for bringing out the issue of trust, because I think it's one of those things that you can't quite touch, but it's so important in terms of work. So it's assumed, I mean, in my background as a medical doctor, first of all, it's always assumed that once you announce that you're Dr. So-and-so, I mean, that's it. You don't have to say anything after that. You know, whatever you say will be taken as the truth. But the reality is that when you now talk about the health system and you watch people's behavior, then they don't always follow what the health professional says. The space I'm in right now is one where, okay, so first of all, we have this issue about having had COVID. So that sort of opened our eyes a lot in terms of issues of trust. So I was in the committee rolling out the vaccine nationally, and my responsibility was around training the vaccinators. And one of the things that came out straight away in our early meetings was, how are we going to convince adults to take a vaccine where vaccine traditionally is something that is given to babies? So you just have to make sure the mother, and that's pretty much been done, that the mother delivers the baby, and then you do whatever it is you're going to do with the baby. So no questions asked. And the shame factor is very high if you don't have a child who is vaccinated. So that over the years has worked really well. So when you get adults who are going to question, first of all, why must I go to the hospital and I'm well, etc., etc. So we had a task there. And we were lucky that we had a cabinet secretary who was media savvy, had a background from media. So we had that kind of a person leading the approach. But we had lots and lots of discussions about how we're going to convince adults to come for vaccine. And I think resonating with what Busi has presented, were a lot of difficulty with younger people, educated, really just questioning. And then you get all these issues about conspiracy theories. Why are we taking this thing? Why is it free? So, why us Africans, we're not dying, etc., etc. Tanzania doesn't have any issue with COVID. So there are lots of questions around that. So in that sense, the report for me does bring out a lot in terms of some of these issues of trust. The sad thing is that public health, so Busi mentioned this about healthcare and health. So I'm in the space of health. And the sad thing that we have is that government in itself, so this is one of the conclusions there, the government itself is not trusted. So collaborating with government is not necessarily a good thing. And the space I'm in right now is that I've been looking at the history, Kenya's history, the regional history, how we came to be. And from colonial times, and this we used even in when rolling out the vaccine, two laws were used primarily: Public Health Act and the Public Order Act. The Public Order Act is a colonial relic used to stop any sort of gathering and so on. It's a very, police will beat you up and use the Public Order Act. And so it's a colonial relic. And then the Public Health Act, also from colonial times, been modified a little bit, but also has elements of coercion in it, that I do what I tell you to do. So not a lot of room for dialogue and establishing trust. So even when you get other professionals to come in and say, let's have a dialogue, it very quickly lapses into, let's just do it. So in that sense, I think it's a really timely discussion to have. And I think we need to look a bit into the background that leads up to some of the issues that have been raised by Busi. Thank you.
Thank you so much for that feedback, and your expertise in sort of guiding through the COVID-19 crisis is so critically important. And you also note what I hope will bring further in this conversation is, how do we go about not defaulting to some colonialist practices and previous strategies, and how do we rebuild in a way that, again, prioritizes trust? And passing it on to you, Dr. Newman, can you speak a little bit about your role with AmHealth and how sort of your experience either resonates or not with the outcomes of this report?
Absolutely. No, thanks very much. And thanks, Busi, for an excellent presentation, and congratulations to Edelman on a very important report. And to both answer your question, Lola, and to pick up sort of where Richard left off, you asked us to sort of look inside, like how do we get here, right? And I think there's a lot of reasons. And I think we need to sort of begin with a validation that lack of trust is a creation of our own making. If our, as a healthcare provider, as a physician like Richard, but as someone who's also worked in government and with government, trust is really essential. I mean, I think the first point is that it's spot on to talk about trust. I mean, something I learned someone said to me several years ago, which I really like, is progress moves at the speed of trust, right? Without trust, progress isn't going to happen. And AmHealth, again, what we do is that we work with governments to help them build leadership and management capacity of the public sector. And actually the foundation of our theory of change is trust. I mean, very interesting. That's why I was so interested when I got this invitation to participate, because it's such a part of my day to day. And you know, we embed mid-career professionals from Africa in these government teams. And we're very clear on the brief. You know, these are mid-career professionals that got a lot of experience. And we ask them just for the first 3 months to listen. And I think that one of the things that we really need to remember if we're going to rebuild trust, we have to relearn how to listen. And we have to listen genuinely, not listen as a tick box, we've heard you and we move on. But if we're going to listen, and that starts within teams, it starts at government, but to take it further, this is about listening to communities, listening to people, and everything from the research agenda to the implementation of healthcare programs. We need to involve people at every level, from national to community, and we need to listen to them, and they need to be part of it. And I look forward to, as the conversation continues, picking up on some of the other themes that emerged today, but want to make sure there's time for others.
Thank you for those comments, Robert. And again, we'll dig deeper into what listening really looks like right now, and how we translate what we hear from our different sides of the sort of health system response team applies to how we develop new policies and programs that are enduring and meaningful and embed trust. And now over to you, Lola. With your role at AMREF is so important. Again, you reflect the audience that we are talking about, the people that we need to listen to. So can you just talk a little bit and your reactions and how we can be better and present better as we look to the future?
Sure. Thank you, Lola. And thank you, Busi, for just walking us through the trust report. It was a stark reminder of, how far we've come, and my goodness, how much more we still have to do around trust. And as Busi presented, I was just thinking about AMREF's history. I mean, we've been around for a little over 60 years. And I was trying to think about, so what are the things that make people trust us? And then when I heard Richard say, you walk into a room, announce you're a doctor, and everyone says the truth has arrived. But so I equated that in AMREF in a way to say, just because we have this long history in engaging with communities and providing tailored solutions to communities does not mean that we have this entitlement, right? So it goes back to what Robert just said around listening and really understanding what the needs are and not taking trust for granted. One of the things that was also really interesting, I mean, of course, Busi talked about addressing inequalities in health. And while that is the core of our work at AMREF, I mean, we very much work at that intersection of what the community needs, how do we respond, how do we partner with government, our other peer organizations, and so on, with a goal to provide sustainable primary healthcare services. So while that is the core of our work, I will say one thing that struck me was the investing in employee health. And that's quite strange because we're a health organization. That is what we should do. But I will say, and with lots of embarrassment, that we have not been intentional about that. I say, of course, with bias, public health folks, and I think maybe just health workers in general, will work until, the wheels come off and we're just still chugging along. And, doctors make the worst patients, as people say. But I think we just sort of forget to take care of us and to take care of our own staff. And COVID was, of course, a very stark reminder of that, whether it's in promoting, services around mental health, encouraging holistic wellness, and really just aiming to give people space to just be, even in the workplace. And I thought about this just in terms of that, the importance of taking care of our own, because they then become the ambassadors of the organization. And they're the ones that we entrust to engage with communities and design these solutions for communities. So I feel there's so much to unpack in this report. It's a really interesting report. And thank you so much, Busi, for presenting that. Back to you, Lola.
Thank you for those reactions. And so into the conversation we go. And Lila mentioned this at the top. We are very, there's a need and a gap for data and the use of concrete information to inform decision-making. And this report is one of those very robust data-driven reports. With that said, we also know that we can't just rely on the data. We have to be able to translate it in ways that really enable decision makers to react, that also enable patients and clients to be able to make decisions for themselves and for their families and communities. So a question for you, Dr. Richard, and also for you, Dr. Newman. Can you speak a little bit about how, as government representatives and folks who work directly with government, how are you going about working with partners to translate data and enabling them to use that as a positive tool for informing how new policies and new programs are designed?
And yes, we've seen that has changed significantly. And we've seen that communities have come to trust the person that they see trust and see living in their same circumstance and is going through sort of the same experience that they're going through, right? So just as that person is the information holder, if you will, that person is also trusted to be the voice, the one who will now take our needs and our concerns and present it to, whoever the masses are or whoever the decision makers are. We did a visit to Kwale County here in Kenya, and went as far as almost the border with Tanzania and visited a health clinic there. But then our visit was really with the community leader and some of the community health workers and some of the persons who were considered influencers in that community. And one of the things that they were doing as a community that really struck me was that they have these community scorecards, which are it's prepared by the government, but then they use the community scorecards to rate the clinic, right? So they go into the community to household level, they gather information. That information is gathered, aggregated by whoever is selected as the community, the lead community health worker. Then they come back and there's a meeting. So when we were there, we happened upon the meeting at the clinic with, the lead consultant, the nurse, the administration, all sitting around, and this person then saying, here's what the community thinks of the services provided by this clinic. And here's what we think of safety. We think of cleanliness, bedside manners. Here's what we think the clinic needs to work on for, services that we seek at the clinic, for outreach services, your relationship with the wider community, etc. So you see in that example, not only does it show, the need for this feedback loop when we talk about advocacy, but it's also that advocacy doesn't have to be this really grandiose thing. It's advocacy at that level, because this lead community health worker and the community, the community leader / chief is entrusted by the community to be their voice and to advocate for them in front of the clinic lead, the administration, etc., to say, the fence is broken, so we don't feel safe. The last time we came and it was raining, the roof was leaking as, I had my consultation. So what is it that we can do? We noticed the last time there was a pile of rubbish. This can lead to XYZ. We noticed the toilets were not working, or we noticed this particular nurse is just really great. We love her bedside manners, and so on and so forth. So that advocacy, and I liked what the report said about, advocacy for the truth. That trust in who advocates for you is important on so many levels. So it can be the community leader, it can be civil society organizations, but the community gets to decide who that advocator, if you will, or that advocate is for them.
Excellent remarks. And it reminds me that, we here at the Aspen Institute really focus on leadership. And what you're noting, all of you, is sort of the role of leaders and how it manifests in different ways at different levels. And so a question to you, Robert, around leadership and to all of you. I would love to hear, the demands of leaders are different now. And governments and other partners are asking or have to present themselves in new ways. So can you talk a little bit about how you and government partners are thinking about the role of leadership?
Sure. Yeah, I mean, I think the key thing is there isn't one leadership style that works, right? But I think we've always known, but I think has really been put into sharp relief by COVID and the responses to it that were successful and less successful, is that we often conflate being in a position of authority with being a leader. And those things are very different, right? Just because you're in a position of authority doesn't mean you have leadership skills. And you can have great leadership skills and exert them without being in a position of authority. So both of those things are true. And I think one of the ways that we tackle this at AMP is, we show up in a team at the request of a government to help that team build leadership skills. And you'll notice I'm using the word team. We often think of leadership as an individual enterprise, right? Someone is a leader. And I think there's more and more recognition on the power of collective leadership, right? That teams are actually very effective. I mean, the Edelman report speaks about the power of business. Business has figured out this long ago. You talk less about an individual in business doing something, but a team succeeding. And I think when we talk about public servants and public sector, we need to think about how do we work with teams to develop leadership skills as a team? Obviously, individuals need to develop that, but they need to learn to trust each other, to get back to this point of looking internally for trust. And a team that has skills, that learns to trust each other, that's a much more effective team and able to execute and achieve the objectives that it sets out for itself. It also sets a tenor for government that if there's a culture of trust, the way people behave, it's not sort of leadership through authority, but leadership through different styles. One of the things we really work on in AMP is a coaching mentality. How do we lead through asking questions? And if we can show up and ask questions of the communities we're trying to serve, of the people we're trying to serve, and that's the way we lead, that's very different than showing up and saying, these are the data, this is what we're doing, listen to me, this is the way we're going, right? And so I think, the idea of collective leadership, empathic leadership, and servant leadership. And these are some of the mentalities that we're trying to work with governments to realize that those are very powerful lenses by which to look at leadership that actually begin to create a culture of trust, not only within government at a central level, but that cascades all the way down and begins to address, I think, the point that the Edelman report makes very, very pointedly is that there's been a loss of trust in government and in healthcare delivered by government. And I think that focusing on different types of leadership, on a leadership that's really based on questioning, on collectivism, on empathy, on servant leadership, that's a way to rebuild that trust.
And Dr. Aya, I would love to hear from you. You have this political hat as well. And so we can't forget the role the politicians play in this.
Yeah.
And so I would love to hear your reactions.
Yeah, I think one of the things I like about the report and this discussion and this thing about data is that less and less people can't hide. So the one good thing about data is you can compare, and with all the stuff that has happened and going back to the issue about COVID, you can compare. So people can ask questions and say, how come you're telling us this, but in this other space it seems to be different. So why are we different? So that I like about the report, and once it builds up some momentum, people can begin to ask questions in terms of why aren't we receiving the same attention. The other point I wanted to make about data is that we tend to think of data just in terms of numbers, but things like pictures are also very powerful in terms of giving the same message. So data numbers, yeah, people struggle to understand exactly what it means, but pictures and so on can convey the same thing. Thanks.
And such an important point, alluding to the fact that there are other ways of knowing beyond statistics.
Yes.
And Lola, can you talk a little bit about how AMREF works to garner that other ways of knowing and information and sort of connects those to other decision-making partners?
Yeah, no, absolutely. And I will say, these other ways of knowing have also really evolved as approaches have also changed. So we've also had to be very creative and quick, right? So we find that yes, we've primarily in the past, we've primarily used community engagement as our tool to get information, to really understand, observe communities, really be entrenched in the various and very different communities across the African continent. But sometimes the community engagement is really not enough. Sometimes it might be also balancing that with being very active on social media, right? So at AMREF, we're very active on social media. We're always scanning the social media landscape to see who's talking about what kind of questions are people asking, what are people putting out there, and how are people also challenging us? I think social media is also one way in which, you just can't hide. I mean, once you put yourself out there on social media, you're sort of, maybe I'll say free game. I mean, people will ask, people will push. You're open to trolls as well, but I think that is also a form of information gathering, because it tells you whether your message is resonating or whether your message is raising more questions or whether it's just raising doubt. So in this mix of information gathering has become really pertinent to us. And it's not only from the communities, it's also from government as well, right? Because part of working with communities is ensuring that we're also able to balance what is possible under policies as guided by government and also the community's needs. So we can't say, because this particular intervention will work in a community, let's go ahead and do it. What if the government policy does not support that? Then you put out hope and you can't deliver. So that information gathering, it also includes our discussions with government, trying our best to be part of technical working groups, trying our best to be in rooms of decision, even if it's as a silent partner, just so that we can always understand where the government is going. We can always understand how to influence and know when and where to influence some of those decisions. So I would say it's really a combination of different approaches. But what's key is to be open to always changing, because everybody changes all the time and we're all unpredictable. So if we're not open to change, then we become very stagnant even in the information that we get.
Such an important point about leaving that room for adaptability and for flexibility. And I'm wondering from all of you, I mean, we're all employers in some way. We have teams, so we have an onus upon ourselves to embed that culture of adaptability. So I'm wondering, as employers, and again, that's a key theme that came out of this important report, is the role that they play. How are you all embedding a sense or a space for pushback when there is a disconnect between the data and the reality within which people live? And then perhaps how have you, as employers, embedded new strategies to ensure that there is a culture of trust within your organizations? Because, you know, the answers and the solutions start with us.
I mean, I can start there because I think the employer environment is challenging. Huh? I mean, we're the organizations that I'm involved in, we've had since COVID times, we've had these rounds of retrenchment, and it was mentioned earlier, issues, I think Pussy mentioned, issues of mental health have come to the forefront. And I think we're not too sure how to handle those well enough. So when we talk about new things, to me, one of the big new things is how to manage mental health, especially in the amongst younger employees, where older people feel, well, we went through that, so that's not something you can come now and put under mental health space. That's life, as it were. So I think it's challenging in terms of getting the divide where it becomes healthcare and where it is, I don't want to use the word normal in quotes, but given that we're in an environment where there's huge unemployment, so it's quite easy to say, let's just get rid of this person, and there'll be another 1,000 people to hire. Fine, we'll go through something. But so I think we're challenged in that space. To me, in the report, it was one of the things that raised this needs some thinking about in terms of how big a role should employers play. I mean, the government in Kenya is going through, increased taxes and trying to collect more money for the welfare space. And in a way, that would mean that employers would be saying, okay, the government should now take care of that, not us. So to me, it's something it's something to think about a little bit more deeply.
I think there's a lot of great points, Richard. I think all true. And I think the emphasis on mental health is really important. One thing is to really take organizational culture seriously, to make that a focus. And so we talk a lot about culture, and we're an organization, we've got our home base in South Africa. We're working in 12, 13 countries across Africa, complex environments, many of them. And if we're going to work as embedded mentors and coaches to minister to public sector teams, we need to live that truthfully. We need to live the same thing we're trying to teach. And so, we very much try and build a team culture. We have a very collective leadership style at different levels of the organization. And we really try and model a style of leading by coaching. We ask a lot of questions of each other and try and help people to get to their own answers, not leap in with solutions for them, and really create a space where people feel both responsible and empowered for the line of work that they're in. And I think that actually is an important component of mental health, this feeling that you actually have agency over what it is that you're working on. And the other thing we do very intentionally as part of our culture is that we do a pulse check of all our employees. So we're about 25 people, and we're spread out again over 13 countries. And every other month we send out a pulse check, and it's from someone who's sort of semi-independent from our team. He works with us on coaching, but he's not formally part of the team. And it's anonymous. And we ask people a series of questions about their happiness, their work-life balance, their health. But one of the key questions is, do you feel free to speak your mind? Right? And, at the beginning, most people did, but we weren't where we wanted to be. And we have very purposefully tried to get to the point where now, the last couple surveys, absolutely everyone has said they feel free to speak their mind. But that's been a very purposeful, intentional thing of how do we create a culture where everyone feels that they can speak up and say what they have to say without fear of any sort of retribution for them. Over.
Yeah, I think, Lola, that's a great question. Building a culture of trust in organizations is very hard. I mean, it is tough. We've struggled with building this culture of trust, primarily because we are a massive organization, and we sit in so many different countries. There are about 2,000 of us. Yes, 90% are sitting on the African continent, but even on the African continent, we're in 10 countries. Then we have Europe and North America. So first of all, just even so many different cultures and a completely different mix. And then trying to figure out what trust in the workplace means for that mix and employees and and even the ones, for example, in Kenya, in Nairobi, where we're headquartered, we have, I think it's like 650, 700 employees in Kenya. But even then, we're not all in Nairobi. There's some as far as Mandera and so on. So building this culture of trust is a challenge. Over time, we've done a few initiatives like, measuring enablers and disablers and having focus groups and really trying to get into the weeds of things, and also doing, what are they called? Like the step down conversations. And that has helped, but we're still so far away. I don't even have an answer. I mean, we just keep trying. In the organization, though, there are two things that I think have worked in terms of being able to speak up. And I think they've worked because, at our leadership level, it's difficult to sometimes get the pulse of the organization, let's say at our project level. But one of the things that has worked for us is that we have an ethics hotline. It's anonymous. We don't know who reports. We don't know. And it's 24/7, anytime. And the ethics hotline, no one is spared, including our CEO. So anyone can report on the ethics hotline. It is audited, it is reported, and it's taken very seriously. And some of those issues go as far up to the board. And people use it. People use the ethics hotline. And that really has been very good for the organization. The second thing is we have a quarterly CEO town hall, and we use an anonymous platform for people to post questions. I will say sometimes the questions and comments and feedback are very cringeworthy, but nonetheless, they tell us what is really top of mind for staff, what is bothering staff. And sometimes it's as simple as, how about that discussion we started 2 years ago on a 13-month pay, right? So what happened to that conversation? Or, you as our leadership, we don't really see you. We don't feel your presence. Why is that? What are you busy off doing? So and you're forced to respond because the entire organization sees these questions before the town hall. So you can't say, well, I missed that question. The questions are there. So that has helped, but it is an uphill battle. It's a very difficult task. I think we've tried, but I wouldn't say we're even at 50%. So it's just very difficult. Yeah.
Thank you. And we have an even more difficult question that just came through in the chat about some of the other factors that impact trust outside of the health system. For example, corruption and/or economic hardship. And I'll look to any of you to answer. How are you all combating some of these external factors that influence trust? Or are there, and Willem, you just gave a great example of the ethics hotline, which is great for an internal reaction, but curious for, all of these outside factors, and you have social media and other folks who are countering a narrative that your organizations are leading. What are the systems that are set up to counter a narrative or to counter immediately or in real time misinformation?
Maybe I could just talk a little bit about that. I think one of the, and this was going to almost be my conclusion, but one of the things that what COVID-19 brought out was that to build trust, you have to be proactive because of all that was going on around. And because it was sort of a unique situation, once the initial bit went over, we sort of lapsed back into wherever we came from. And then there's this vacuum that then gets occupied by misinformation and so on. Corruption is a big topic. I can tell you, for me, part of what I learned and what I do personally is that I work with a number of journalists. So I've kept a little network so that we're able to, they can call me up as a professional. I don't have to have my name in the forefront, but at least they will fact check before publishing. So that has continued in the health space. That's just a personal thing that I do because then I got those contacts and can be able to get an article here and there, and even in terms of social media. So we keep that going. The other bits, because politicians are overbearing in our space, it's very hard to contradict. So I think it needs work when we're talking about the health system. So part of what Busi presented in terms of leadership from the business community and everyone else as well, it needs to be there. I think we've had some other discussions even about health professionals who are working within the public sector, that it's you can't keep quiet, but at the same time, you don't want your head to be the one that gets hammered. So there needs to be some collective safe spaces where people can give out their positions. So kind of like what we're talking about, the ethical hotline. So within the health system space, there are a few. I know within the HIV community, in terms of providers, they do have some forums where people can ask questions and so on, and just check on what is going on. But there's not enough of it going around.
You know, I think, just to build on that, I mean, I think that, you know, to do this, a lot of this is just investing in leadership and management in general, just to get back to the leadership theme. I mean, one of the biggest ways to you know, get better accountability and fight corruption is to just invest in people's leadership. We're guilty continuously of magical thinking as a species. We think things are just going to happen by accident, and they're not. You know, and in addition to my role as director of AMP Health, I also chair this high-level council on leadership and management for development, which is hosted at the Aspen Institute, and that group of former heads of state and former ministers across health, you know, education, economic, you know, environment, agriculture. That committee released a report in late 2021 and really called on governments to say, you know, you need to invest in public sector leadership and management. And, you know, the number we came up with, and this comes out of the business world, you know, businesses invest about $500 per person per year in leadership development. That doesn't mean everyone's getting handed $500. So the aggregate number. And there's no reason government should invest less. And, you know, when you make argument, people are like, no one's going to spend that kind of money, you know, and we picked it apart and we just took Ghana's health service as an example. We said, well, if Ghana spent $500 per person in its public, in Ghana Health Service, it would be spending about $20 million a year in leadership training. People are like, that's crazy. No one's going to spend $20 million in leadership training. But the fact is, Ghana's spending $1 billion a year in healthcare. And if they got so much as a 1.2% efficiency gain in that spend, that program would pay for itself. So I think, you know, if we talk about this and we talk about leadership and management skills, right, to add management to it too, because it's one thing to have a visionary leader, but you need meticulous management to go with it. We're going to have to invest in it. It's not going to happen by accident. And it's big money, and it takes a lot of time and a lot of patience. This is not a quick win. And the things that are, I think, being uncovered, we see problems, we want quick wins. What the Edelman report has uncovered is a hugely complex problem that does not have a quick solution, and is going to require both investment of time and investment of money and investment in people, and a recognition that we talk a lot about, you know, commodities and infrastructure and development, but putting the focus back on people and on human capital is where we have to go, because at the end of the day, the story of trust is one of human capital, right? And building people's capacity to lead, to manage. And with that, I think we combat the problems. And we need to learn from the business world, right? In terms of what they invest in that. And at AMP Health, I'm not hiring public health professionals to put in government. We have enough of those. I'm hiring my perfect person. I'm hiring away from a bank, right? From a private sector company. They're mid-career, they're 40 years old. They know how it's done in private sector. And then they go and spend 2 years as part of a government team. We need to learn better how to cross-pollinate public and private sectors, because I think the bringing together, and I think that comes out of the Edelman report as well, is part of the solution.
Yeah, no, I totally agree. I think maybe the missing piece in this is, we know there have been several courses and several iterations and initiatives around leadership management and governance, and it's extremely important. I find that we need to also look at, when do we introduce that? Because you'll see a lot of times that we introduce it at such a later stage. Okay, now very specific to the African context, I think it's introduced at such a later stage when one is, slightly established or set in their ways. And so it's quite difficult to have that mind shift. So, and I think it's figuring out what is that sweet spot when you can influence a mind shift, when you can introduce other ways of looking at leadership, right? I will dare say that, I think in some of our countries, let's say our parliamentarians, our senators have learned from what they've seen before, right? So we get the same type of leaders that are put out into our society. But then if you have this sort of mind shift in the way we look at leadership, even looking at leadership in terms of a devolved function. So while the hierarchy might be there, but how do you, shall we say, democratize leadership? And how do you help leaders build the teams that they need to deliver on whatever their goals are, right? So instead of forcing a leader to do 5,000 things, maybe they can only do 2. Great, they can do those 2 things. What team do they need around them to do the other million things that they need to do? So I think we also need some creativity in how we do this. I really like what Robert said about not thinking that the public health person is needed in the public health space. You might need, I don't know, an architect in the public health space, but it's that diversity of thought as well that's needed for us to just have dynamic leaders. I get really bored when I go to some of these meetings and conferences where you can fall asleep and follow the program because there'll be a declaration, there'll be and we approve this and on behalf of, and then there's a declaration. Nothing has been said. So it's just, how do we, I don't know. I want us to have I want us to have dynamic leaders. That for me, I think will really, really change a lot of our social sectors on this continent.
I mean, nailed it, Lola. Wonderful last words. And what you all, there's no way to summarize. There's so many incredible sort of highlights and pieces of guidance that you all have shared. But I do want to name a couple of things that have come through. One, the importance of leadership, but also this need for, and as it came through in the report, this dispersion of authority. Who is actually the ones who are best situated to, again, not just build trust and tackle misinformation, but be seen as the experts. And I love the way that you all are taking different approaches to thinking about that. And the other thing I want to note is the importance of conversations like these. We are clearly very interdependent. And all of you leaders reflect expertise and depth and networks that are beyond one country, beyond one community, but in fact are truly global. So I hope that this is the beginning of many conversations around, one, how we can communicate and learn across quote unquote boundaries that we perceived and or real, about how we rebuild systems that truly embed trust, and that also have, is what has come up here, the space for safety and truth telling and honesty and mistakes when mistakes happen. And that is really the profundity, the profoundness of what true leadership means. And so with that, I want to thank this incredible panel, thank the Aspen Institute Africa for bringing us together virtually in this space. And then I want to give a few minutes, never enough, because this report is so dense and so important. But Busi, to you, for any reflections, closing remarks, any thoughts as how we take this work forward?
Oh, wow, this was really an interesting and really exciting conversation. I really enjoyed it so much. I couldn't imagine so much could come out, you know, of the simple report that we've shared. So, but it was really thought-provoking. I really want to say thank you to the panelists for just really adding so much to this. And I think if, you know, just thinking about everything that was said, and the thought that came to my mind, and also looking at some of the questions that were coming through, you know, on the chat, is sometimes when we talk about trust, it can come across as an airy-fairy, elusive concept where it isn't clear. What do you mean? How do you know when you've got, you know, you've got the trust as an organization? And I thought maybe it would be quite important maybe just to leave behind what are some of those trust dimensions, something that's very tangible that you can actually measure yourself against, either as an organization or as the leader. Because with this conversation that led to leadership as well, and then it becomes both on a personal perspective and the organizational perspective. So we look at trust and say there are approximately 5 dimensions of trust. First one being the ability, which is functional trust, you know, where you have to prove competence, either as an organization or as a leader, that you can do what you say you can do. So the thing the public, your customers, the health citizens are trusting you to do, you've got the competence to do. And sometimes when we look at the different institutions in society, that is the difference between government, business, and NGOs, because it's sometimes the level of trust in the competence. And that's something that we need to portray and say out, are we competent? Are we showing our competence in that? And then secondly, it will be on dependability. Again, doing what you said when you said you would do it. And that talks to reliability. That's a key aspect of trust. So you can check on, have I delivered on the promises that I've made? And I'm just touching back on when Lolem was making an example of their town hall. Some of the questions that you'll get from employees, somebody asking, what happened to the conversation that was started however many months ago that just sort of, you know, fizzled and nobody knows what happened. And it happens a lot internally. So sometimes those organizations, we prioritize what we do and the face we have externally and a lot less internally. We're like, okay, we'll update them when we've got something to update. And we don't actually treat employees and internal stakeholders the same as we do external stakeholders, but actually they are also holding us accountable. So that whole principle of under-promising and over-delivering becomes quite key, both internally and externally. So that talks about how dependable are you. And then the third one is integrity. It talks about now honesty. You know, you understand your morals and ethical, that talks about that moral and ethical trust. So that's another tool or one of the tick boxes that you check as an organization to see how you fare in terms of trust. The fourth one is purpose, and that ties into your environmental and societal influence. What role are you playing into the bigger societal issues? Or are you only just focusing on yourself and your organizations without looking much more on the, the broader impact you have on society? That's why ESG and such things are so important in these days, because it shows that you care about the environment and the society that you're part of. And lastly, self as a person or the organization in terms of your own personal and cultural relevance. It's so important to be relevant within the time and the landscape within which you operate. So I just wanted to ensure that trust is not, it's not a feeling. I feel that we are trusted. It's not a feeling. It's actually something you can measure to say, how do we fare against these things? And then you will be able to see which area you should be improving on, and then you can employ and deploy certain tactics to actually improve those specific areas. So yeah, I'm excited. I've had a lovely time engaging with all of you on trust, and I think there's just so much more to unpack in the future. Thank you very much.
Thank you so much. And thank you all for joining us. And on that, I'll close and hand it back to our colleagues at the Aspen Institute Africa Initiative for final remarks and closeout.
So thank you, Lola. Thank you, our panelists. And we just thank you for taking the time to be with us and to learn more about the role of trust in health. So the Aspen Africa Initiative will continue to host these thought-provoking and enlightening dialogues that are data-driven. So we want to thank the audience for joining us. Please follow us on our social media handles for event updates and engaging conversations on Twitter. We are at Aspen Africa and LinkedIn at Aspen Initiative Africa Nairobi. So keep an eye out for our next events and gatherings, and thank you for being with us today. Good evening, good morning, and have a good day from wherever you are.